Evening. You've all heard about X-rays in diagnosis. Tonight we're going to hear about X-rays in treatment, the treatment of cancer. And for this we're going to the largest treatment centre in the country at Manchester, probably the largest in the Commonwealth. But before we go there, one or two things about cancer, because an awful lot of people believe a lot of nonsense about cancer. First of all, there's nothing new in cancer. Egyptian mummies have been found to have cancer, and as a matter of fact in the British Museum there's actually a dinosaur skeleton with a cancerous condition of its backbone. So that's 150 million years ago. The reason people think it's new, of course, is that it largely affects old people, and there are more old people alive today. The second mistake people make is that they think cancer is incurable. In fact, there are many kinds of cancer that are curable. And they're curable in various ways. And we're going this evening to see how they're cured by X-rays. This evening's programme is in fact part of a campaign of public education which has been carried out over the last 5 years in Lancashire to educate people to knowledge instead of fear. Well now, what is cancer? Well, let's look at a diagram. Here we have a cross-section of somebody's skin. Underneath the skin there are a lot of little round things which are cells out of which the body is made. They're too small to be seen except under a microscope. Now supposing the skin is cut like that. The cells have a job to do, and what they do is start multiplying, and they grow up like that by multiplying until they fill in the hole like that, and then the skin comes together again as they contract and the cut heals. These cells know when to stop. They know when they've done their job. But sometimes cells start growing quite wrongly, and these are cancer cells. We don't know why, but for some reason they just start growing when they shouldn't. Let's look at another diagram. There we have the cancer beginning to grow, those little black things, and they go on growing like this. We don't know why they do, and form a little lump or a tumour under the skin. If they go on growing, they may break through the skin and form an actual ulcer. Now we can cure the cancer at this stage by taking it right out by surgery, or we can kill the cells by X-rays, because cancer cells are more easily killed by X-rays than normal cells. Now the important thing here is early diagnosis, because after a bit the cells get into the bloodstream and may spread all over the body, and if they damage a vital organ then it may be fatal. So let's go to Manchester and see how X-rays are used in the treatment and cure of cancer. Here we are at the Holt Radium Institute and Christie Hospital, about 4 miles south of the centre of Manchester. Here we come in at the main entrance. You must be getting used to hospital corridors in this programme. Here's one in front of you, and here we meet the director of radiotherapy, that is X-ray treatment, radiotherapy, in this hospital.
Good evening, and may I extend to you all a very cordial welcome to see our hospital and to see some of our work here.
Well, good evening. Perhaps you will now take over from this point and show us round.
Oh, most certainly. Let's begin at the beginning. Our patients are first seen in the outpatients department, sent up either by other hospitals in the region or by their own doctors. So the first department we visit is the outpatients. There, 2 of my colleagues will show you patients who are going to be treated by radiotherapy. These people came up to the outpatients in the last few days, and they've been good enough, in the interest of public education about cancer, to appear in this program. And we are very grateful to them. Now we'll go along in. Now here we are in outpatients. But before we look at these cases, I want to make one vital point. We have every expectation of cure in each one of these growths. For these patients went to their doctors for advice while their tumors were still early and small. Let's look first at a gentleman here with a growth on his lip.
This patient first noticed a sore at the angle of his mouth How long ago was it?
9 weeks on Monday.
9 weeks on Monday.
Yes.
It showed no signs of healing, so he saw his doctor, and now he's here for treatment. Can we have a look at this?
Yes.
Thank you. Just open a little bit, and if you turn round this way. That's the thing. Thank you. We shall see the type of treatment he's going to have quite shortly. The second patient was first aware of a warty growth on his ear about 5 months ago. It increased in size, he saw his doctor, and now he's been referred here. This is very much the type of cancer that can be treated either by surgery or by radiotherapy. Surgery means the removal of the growth and part of the ear, and we're treating him with radiotherapy in order to save his ear.
This woman here noticed a growth inside her mouth some time ago, and she went to see her doctor because it was gradually getting a bit bigger, but it wasn't painful at all. Perhaps we might just have a look at it, please. Just open your mouth. Right. Just there on the undersurface of the tongue you can see the warty growth, and she's going to have treatment for it. Thank you. Now this is another patient I'd like you to see. He noticed something wrong with his voice. How long ago was it?
About 3 months ago.
It went hoarse then.
Yes.
Has it been sore at all?
So
But not the sort of sore throat of a cold. And he went and saw his doctor and was found to have a small growth on the vocal cord, and he's now going to have some X-ray treatment for it.
There we have 4 different growths, which we think will respond well to radiotherapy. 3 of these tumours happen to be visible, so we could show them, and the other you heard. Now there are many others which can't be shown, but are equally curable. For instance, there's cancer of the breast, where surgery is so very important. Then there's cancer of the womb, usually treated by X-rays and radium, as we'll see. Now both of these, if taken in good time, have excellent expectations of cure. We'll be showing you in a few minutes some of the methods we use, and you'll see for yourselves that there's nothing very dreadful about any of them. It is, however, a very precise business, calling for great accuracy. So we have a special department to help us with this problem of ensuring accuracy. And that is the next department we'll have a look at. So I am now going to pass you over to my colleague who will show you the kind of work done there. It's quite an elaborate and craftsmanlike task, as you'll see.
This department is the mold room, and here specially trained technicians make the appliances needed for both radium treatment and X-ray treatment. By the way, before I tell you about the work, perhaps I should explain what this badge is. It shows how much radiation we get during the course of our work. One of the earliest methods of using radium was merely to lay it against the skin cancer. We now know that this was not accurate enough. Something far more accurate is called for. And what we need is just the right amount of radium held at exactly the right distance and for the right length of time. This is where the mold room people help us. Here's a model of a patient's head with a cancer on the forehead. We decide how big an area requires to be treated. And then the mold room people take over. First, they must take an impression. They do that using ordinary plaster of Paris, the same sort of thing as is used in the treatment of fractures. From that impression, they make a model, also of plaster, and it's on that model that the mold is made. Here's the first stage, a sheet of plastic material, heated in a flame until it's soft, laid over the model, pressed firmly into position, so that it fits exactly. The final result, after it's been trimmed up and straps have been attached, looks something like this. Then we have to build a platform on it. to carry the radium at exactly the right distance. The platform is made of plastic too, and the distance we get by using ordinary corks which are cut to size. Then the right amount of radium is put on. Needless to say, this isn't real radium at the moment. A cap is fitted, keeps the radium in place, and the whole thing, the final mold, rather a good-looking article, is made to fit this model just as it would a patient. That's it. Now, that's a fairly simple type of mold. Something more elaborate is necessary for this patient. You've already seen him. He needs a double mold with radium inside the cheek and also outside the cheek, so that the growth is sandwiched between the two lots of radium. We'll ask him to put in the inner part of this mold. That's the way. All right, and the outer part is then fitted on. Is that fairly comfortable?
Yes.
Right, thank you very much. Now, a different problem is presented by more deeply seated cancers. They've got to be treated by beams of X-rays coming from outside the body inwards. And these beams have to be directed very accurately at the center of the cancer. Here's how we set about treating a cancer of the larynx. First of all, a collar of plastic material is made in very much the same way as the radium mold is made. It fits the neck exactly. On the collar, on the front and the back, we place these metal markers. And when an X-ray picture is taken of the patient wearing this collar, these markers show up on the X-ray film as these dots, these white dots, both front and back. On the film, we also see the site of the cancer, and a line is drawn from front to back through the estimated center of the cancer. Now we can reproduce this line on the collar by putting this rod through. It's just a bicycle spoke, putting this rod through at exactly the right spot. And we're able to say that somewhere along this line is the center of the cancer. Its exact position we get from the X-ray film, put another spoke through at right angles, and here is the center of the cancer. Then we decide on the size of the beams and the number of the beams necessary for treatment. In this case, we're using 3, 1 from the front and 1 from each side, all of them again directed exactly at the center of the tumor. As a final step, the mold room fixed to the collar these wax seatings. The spokes are removed, and it is against these seatings that the X-ray beams through which the rays come are placed during treatment.
Thank you. Well, now, that's the technical side of the matter, but I'm sure you'd also like to see some patients being treated. So may I follow this up by taking you next to the X-ray department where these devices will actually be used. And here we are, going up to and into the X-ray therapy department. And I'm going to ask my colleague there to tell you something of the work she does there.
Well, as the director told you, this is the X-ray department where we give the X-ray treatment. Here there are 9 machines because we've got so many patients to treat. Now come with me and see how the treatment is actually given. In this room here, we have a man who's having treatment for a growth in his throat. In the mold room, you saw this shell being made. Here's the patient wearing it. It's quite comfortable, isn't it?
Yes.
Now this is the X-ray machine, and that's the applicator through which the X-rays reach the patient. Now we'll just get him into position, please. The applicator comes in contact with the wax, And we want to make absolutely sure that the center of the beam of X-rays goes straight through the tumor in the same way as the bicycle spoke did in the mold room. Now, if it did go straight through the tumor, it would come out at this exit mark here. So to make sure that that does happen, we position the patient so that this pointer is on the exit mark of the beam and the applicator is on the wax. Then we know that the beam will go straight through the tumor from the applicator and out at this point. Now he's all ready for treatment, so we'll go outside the room to the control panel where the machine is switched on. Here we are at the control panel, and the radiographer is just setting the time on the clock to give the exact amount of radiation to the patient. Now she switches on, and all the time she watches him through this lead glass window here. You can see that he's quite unconcerned during treatment because he doesn't feel anything at all. Now here we have a rather different form of treatment for cancer of the breast. Now it's different because the area that has to be treated is very much larger than in the previous case that you saw. But the area is quite superficial and can be outlined on the patient, and so a shell isn't necessary. But each day the radiographer sets up these applicators around the outlined area. Because the area is large, the applicators themselves are large. And that is how a form of treatment is given for cancer of the breast. Now there is another very common form of cancer affecting women, and that is cancer of the neck of the womb. And it's usually treated by radium and X-rays. Now it's not possible to show you the actual radium treatment, but I'll try and explain it to you on a diagram. Now on this diagram here, this is the womb or uterus, and that is the cervix or neck of the womb, and that is where the cancer may develop. Under general anesthetic in theatre, radium is put into the uterus, and 2 other lots of radium are put, one on either side of the cervix. Here I have got the rubber tube in which the radium would be enclosed and put into the uterus. And this is one of the rubber corks which also will be loaded with radium and put on one side of the cervix. An X-ray picture is then taken to show that the radium is correctly in position, and here is an X-ray that has been taken of an actual radium in a patient. Now let's go back again to the diagram, please. The rays from the radium are only effective over a certain area, and that is the shaded area you see on the diagram. Now we suspect that sometimes the cancer cells spread outside that shaded area, and if they do so, they'll be unaffected by the radium and will continue to grow. So we have to increase the shaded or irradiated area, and we do that by directing X-rays from outside the body to the outer edges of that shaded area, and that increases the total area which is treated. Now the X-ray treatment that is given in these cases of cancer of the neck of the womb is sometimes given on the linear accelerator, which is a rather more powerful X-ray machine, and it's in another department, so we'll go across to it now.
Now, this is the last treatment department you'll see, and I thought I'd like to show you it myself. It is, in fact, a medical research council unit. And here we have 3 of our most modern machines. One of them is called the linear accelerator, and we're going to have a look at it. Now, this room we're in now is the control hall for all three machines, and here is the control panel for this 4 million volt X-ray linear accelerator. Now, 4 million volts is quite a hefty voltage, as you'll probably appreciate. Now, because of this, the radiation's very penetrating, and that's why it's so useful to us. But it presents a problem. We must not let the radiation out of the room. So the walls of the treatment room are from 3 feet to 6 foot thick and of solid concrete. Actually, the interior of the room has to be viewed through the wall using this special system of mirrors here. In reality, it's a sort of glorified periscope, but it's got battleship 6-inch steel walls. Now, this is really your patient, so I think perhaps you will carry on from here with your story and tell us about her treatment.
As I was telling you a few minutes ago about adding X-rays from outside the body to increase the irradiated area, let's now have a look at the linear accelerator and see how it's done. Inside the room we have another camera which will show us the equipment and the radiographer getting the patient ready for treatment. Now, this is the machine itself, and I think you will agree it really is a powerful looking machine. This is the end through which the X-rays reach the patient. Now, the patient is lying on a couch that can be moved in all directions. The radiographer is now just placing the patient in position underneath the tube and getting her accurately set up for her treatment. She uses a special device to protect the area which has been treated by radium. She puts in this tray, and this will carry the device. That's it now going into position. Now, that device will also direct the X-rays to the outer areas where we wanted the rays to go during the treatment. The patient is all ready for treatment, but this patient had cancer of the neck of the womb 5 years ago and is now perfectly well. So she's very kindly come along here this evening to show how the X-ray treatment is given nowadays. At this stage, if she was having treatment, the radiographer would leave the room, come out here to the control panel, switch on the machine, and watch the patient through this periscope window all the time she's having treatment. And in fact, she can communicate with the patient by this microphone here.
Thank you. Well, now, that ends the final illustration for you of how treatment is carried out. This time on one of the most modern of instruments.
Well, Doc, we're getting towards the end of our program, and I would just like to ask you two questions. First of all, what do you really mean by a cancer cure?
Let me put it this way. If a patient's free of cancer, 5 years after his or her treatment, the chances that the disease will ever come back have become very small. So we use 5 years as our index of success. I mean 5 years well.
Well, now, about in what sort of proportion of patients do you achieve this success?
I suppose you want me to talk statistics. It depends really on the stage of the disease when the patient is first seen. Advanced cases are one problem. But in early cases of some cancers nowadays, we can talk in terms of 75% cured. For others, in terms of 50% cured. But people don't believe in statistics, even when they're true. So it seemed to us that it would be much more convincing to emphasize this idea in quite another way, to let you see for yourselves. So you're now going back to the outpatients department to see some more people. This time, patients treated more than 5 years ago, and quite a number more than 10 years ago.
Here, every morning, we have our outpatients. Not perhaps so many at any one time as you see at the moment, because normally they come in an appointment system. But this is a very special outpatient session today, because here are a few of the thousands of patients who've been successfully treated for cancer in this hospital at least 5 years ago, and many of them 10 years ago.
Did you say many thousands? Is that every year that you have this?
Yes, indeed. Over 1,000 every year. These patients have attended here regularly for follow-up. And here you see them alive and perfectly well today. We can't obviously look at them all, but at this table, for example, these 5 people were all treated more than 7 years ago. How long ago were you treated?
10 years ago, Doctor.
10 years ago.
Yes,
and how do you feel?
Fine.
Fine. And when were you treated?
1950.
1950, thank you. Over at this table, all the patients were treated over 10 years ago. Would you like to say when you were treated?
1948.
And you feel quite well?
Very well,
You
thank
felt
you.
well since then?
Thank you, yes.
And what about you, sir?
1946.
1946, how long ago is that?
About 10 years, 10 or 11 years.
No, 1946, that's 13 years, something like that. Thank you very much indeed. We must thank all these patients very much indeed for their willingness to come along here tonight to this program.
Just before we say good night, I'd like to add one word. I hope the opportunity to show a little of our work will have helped people to get rid of unreasonable fears. They'd then be ready to deal with cancer just as with any other disease, in a straightforward, common sense manner, for in that way lives can be saved. Good night.
Good night. And I think you'll agree with me that that's a pretty impressive demonstration of the way in which the superstition that so many people have about cancer is in fact false. These patients you all saw have been cured as defined by the director of the institute. Now, we've just been to one large institute, the largest in the country. But don't go thinking that you've got to go to Manchester to have this treatment. Facilities as good as these are available in every region of the National Health Service. That's one point. Another point I want to make is this, that X-rays are used for treating other diseases than cancer. So if you have had X-ray treatment, or a friend of yours has had X-ray treatment, don't think you've necessarily got cancer. There is just one other point too, and that is that I think you will appreciate what an enormous amount of work and what a tremendous contribution has been made to all this work by other people in this vast department. There are all the surgeons we haven't seen, and in this X-ray department there is the work of the physicists who have designed these magnificent pieces of apparatus, who measure the dose with sensitive instruments and arrange this extraordinarily accurate, precise way of treating. Lastly, you haven't seen any red-hot needles or any death rays. There could be no more comfortable and harmless way of treating any disease than by X-rays. Well, that's all we have for tonight. Now, this time next week, we'll be going to Birmingham, where we shall be seeing modern methods of investigating heart disease and their treatment by surgery. Good night.